Hello and welcome to Mike's Minutes. I'm your chapter vice president as well as a member of the Insurance Fairness Committee for New York. I'd like to talk about what's going on in the chapter and in the Insurance Fairness Committee. As a lot of you guys know, there's a big bill going through Albany right now called the Insurance Parity Bill. This ensures managed cares will pay us a full Medicaid rate. And we all know how poorly we're compensated by the managed cares. For those of you who don't know, the Medicaid rate dates back to 1987, and the managed cares are paying up to 40% less that rate. And I'm not really sure how everybody's running a business with that kind of compensation. I know I'm having a really hard time. So I plan on doing sort of a weekly update to keep everybody informed, because I think a lot of people, they question, they say, hey, Mike, what's going on? What can I do? And it gets a little confusing sometimes. So I'm here just to try to help you out, straighten things up. So like I said, we have bill number is S03468 in the House right now. The Assembly bill is A3408, and like I said, that's the insurance parity bill. Fortunately, it has basically passed the Senate. It is in the Rules Committee, which is basically the last stop before it goes to a floor vote. So we've been very fortunate to have a lot of senators on our side. I was able to listen to some of the minutes, and it was all yays and no nays. So it's great. It seems that we really have the Senate on our side. The big problem is the Assembly. If you go online, you can check on how far these bills have gone. And unfortunately, it's sat in the Health Committee for, I think, since January. So this is a big problem. We've been working with Assemblyman McDonald. He is a champion for this bill, and I've been meeting with him almost weekly, and we're strategizing on what we can do and what kind of information we can furnish to the rest of the Assembly to try to get this thing through. But that's something I'll be talking about over the next couple of weeks. I kind of just wanted to start so what can we do right now? What can our members do right now to push this through? I assume that everybody has gotten the call to action email. They've filled it out. They've sent it. They sent it to all their friends, all their family, and most importantly, all their patients. This is very big, guys. If you haven't done that yet, start there. A second suggestion is, like I said, talk to your patients about this. I've been very lucky to have a few of my patients contact their assemblyman. And just the other day, I got 3 phone calls all in one day from different offices. And take the time and tell them your story. You have to tell them your story. You have to tell them that, materials are going up. It's very hard to take care of your patients when you can't get the work done, when you don't, and you can't hire enough employees. This is very important. This is the message we're trying to send. Secondly, I would hit social media. That's very important. You gotta Instagram, Facebook, TikTok. I'm sure you might need to, have your kids help you out on the TikTok thing, because I know I do. Use that. Get your story across that way. Share pictures of patients, share pictures of your office, what you do. My third suggestion would be for you to give assemblyman or senator a call. You can very easily go online and find who your representative is in your area. I know this might take a couple minutes, and it might take some time out of your day to sit down and email them, but I suggest calling them as well. You might not be able to get a meeting with the actual assemblyman or the senator, but you can forge relationships with their staff, which is very important. I feel the best thing to do would be invite them to your office, show them what you do. If you have a clinic or you can meet at a hospital, do that. If you can have them come to your office with patients there, even better. This is what we have to get across. It's all about patient care and patient access. Um, I'll tell you a little story about what happened with me a couple weeks ago. I'm not sure if you guys got the email, but I was lucky enough for the local news channel to come to my office. Unfortunately, I did have to close for a week just to recoup some money and so I can pay the bills. Hey, listen, it's just something I have to share. But it was great. Media does a lot. I had a lot of phone calls these next couple of days from patients and doctors and hospitals, and they all want to support us. And like I said, the easiest way is to click on that link that hopefully the whole academy, the whole chapter has for the call to action. One last thing before I go. I am actually planning, this is something you guys can do as well. I'm planning a patient rally at my office next month. What I'm planning on doing is have patients come. They're going to share their stories. Hopefully I'll be able to get the media there. And the patients can talk to each other, and we could all strategize. So those are just a few suggestions I have, because right now is a very important time to get our message across, because Albany's going to start getting together and planning the budget. So in the future, in the next couple episodes or updates that I'm going to do, we're going to be touching on the antiquated 1987 Medicaid fee schedule and what we can do about that and who we can contact, because that's a whole other part of what we need to do. I'm also going to be touching on Integra, which I realize is a very big obstacle, and what we can do about it and how we can communicate with them and communicate with each other. So that's your weekly update. Hope everybody has a great week and keep fighting, guys. Bye-bye.